Africa is sorely lacking in funding to fight the pandemic. African states need $1.2 trillion in financing until 2023 to overcome the crisis caused by the COVID-19 pandemic, the IMF managing director said on Friday, noting that some $345 billion was currently missing. Commitments from official bilateral lenders and international institutions cover less than a quarter of expected needs, while private capital is still limited, lamented Kristalina Georgieva in a speech at a virtual event dubbed Mobilization in Favor of Africa. In April, the International Monetary Fund estimated the funding shortfall at $44 billion for 2020 alone. It is imperative that all countries and institutions mobilize more to help Africa cope with the crisis, continued the head of the institution in Washington. She said the pandemic will not be able to stop if it is not brought under control in regions like Africa. The continent has more than 1 million cases of COVID-19, and 23,000 people have died from it, the IMF said. GDP is expected to contract by at least 2.5% in 2020, which is one of the worst results on record for the continent, according to the fund. The Bretton Woods Institution estimates that the recovery should start next year, but real GDP will not reach its pre-crisis level until 2022. Deteriorating economic conditions and a loss of jobs could lead to a drop in household income of up to 12% this year, said Kristalina Georgieva. As a result, up to 43 million more people could be pushed into extreme poverty in Africa, wiping out 5 years of progress in poverty reduction. The crisis is also jeopardizing the progress of the last decade in building human capital, including improving health, education and reducing stunting, notes the fund. Financing vaccines. The IMF has dramatically increased its financial assistance to Africa, providing around $26 billion to more than 40 countries in 2020, nearly 10 times the annual average of the past decade as a percentage of GDP. However, he matched this emergency aid with the obligation for local authorities to use these funds to combat the effects of the pandemic. Countries will need to publish audits regularly to be transparent. The IMF is pleased that several countries have already enacted laws and created supervisory bodies, citing Burkina Faso, the Central African Republic, and the Gambia. It also provided debt service relief grants to 22 African countries. For its part, the World Bank through the IDA, the International Development Association, and the IBRD, the International Bank for Reconstruction and Development, provided about $21.9 billion in loans. While these countries lack everything, emergency operations aim to strengthen health systems, support containment measures, provide essential medical equipment, and expand social protection programs. Longer-term development projects must also lay the foundations for a solid and sustainable recovery in Africa, underlines the IMF. In addition, the World Bank is currently working on a financing plan to support equitable access to vaccines and their distribution in African countries. She asked her board of directors at the end of September to approve additional funding of $12 billion to help poor countries purchase and distribute COVID-19 vaccines. He is expected to give the green light next week as part of his fall meetings,